with all due respect.
Hey, we're Josh Ortegon and Greg Gaines, and this is With All Due Respect, the show where we keep it real about health, fitness, and performance. From weight loss to sports development, we're covering the conversations that matter.
Follow us on Instagram at Phenom Fitness, PHNM Fitness, and visit www.phenomfit.com to check out our training programs, coaching, and gear built for real results. Let's get into it.
Good.
All right, we're going live. It has taken me 80 some episodes to feel even comfortable hitting the record button for some reason and feel like I'm not like a deer in headlights. But today we're bringing on Cindy Dabrowska. And okay, thank you very I'm affirmed right off the bat. I'm glad I'm affirmed right off the bat for doing that correctly. And as you described, a endo certified dietitian. Would that be the best way? You explain it. You explain. Please take over from here before I completely butcher this thing. Yeah.
That's not a bad intro.
Okay.
There's just no formal certification for this
Okay.
specialty. Most dietitians are like self-educated, self-taught. So that's just sort of the specialty that I landed on because as many healthcare providers do, they kind of go into these fields where they have sort of a personal tie. So I'm an endometriosis and fertility specialized dietitian. I only work with women who have endometriosis and couples who, are struggling with infertility. And that's in big part because it's a condition that I live with. I've been symptomatic since I was 12. I have a whole story around that. I don't know if you want me to start with it.
I would love it. Yeah, I would love
Yeah.
your personal story on it. Yeah.
Yeah, so, just like many women with endometriosis, when you present to a doctor with, the characteristic symptoms of endo, which we can certainly get into, I was provided with the same options that most women are provided with, which are birth control, hormonal suppressants. Even at 14 years of age, I have this like vivid memory of being in the doctor's office with my mom and this probably about 70-year-old man doctor, turns to me and says, you can also get pregnant, but maybe a little bit later in life, and that will really solve this problem for you. When you're an impressionable 14-year-old, that really like sits with you. Now I'm 35 and I'm thinking like, even though I know that that's not true now, that pregnancy is not a cure for endometriosis, when you're so young and impressionable, that thought really like sits with you. There's a whole other element to that story, but same sort of suggested management strategies as many women experience. I did take birth control for many, many years. That did improve my quality of life quite a bit, but then my symptoms started changing and they started going downhill again. In 2018, I did have to fight to get a surgery, but I finally did get the surgery and the formal diagnosis of endo in 2018. Although the surgery didn't really help resolve the symptoms for me, it was really great just to know that I wasn't crazy, right? And then you could put a name to this condition and this constellation of symptoms I was experiencing. And when the symptoms, weren't improving even before surgery, I just thought to myself, there are so many chronic inflammatory conditions that can be successfully managed with diet and lifestyle, right? Diabetes and various other metabolic conditions. And I thought, couldn't it be the same for endometriosis? So I started digging, I started researching, I started applying all these, different strategies. And now for, well over a decade, I've been managing without any kind of hormone therapies or additional surgeries. And that's really what I do in my practice. So it's a lot of, functional medicine based interventions, lots of like deep dive testing, trying to figure out, what's really contributing to these symptoms, making them a lot worse. And then, we don't fully understand the cause of endometriosis quite yet. There's more and more interesting diagnostic tools coming out, but you can't really get to the root of the disease because we don't fully understand why it happens. But we do know that there are many, many things that contribute to making those symptoms a lot worse or to disease progression. And so, that's kind of really what my work is centered on, trying to figure out those things and working with patients to make them better.
So you started experiencing symptoms, if I hear sorry, at 12.
Yeah, so
And
that was when I had my first period. Yep.
okay, yep. And then you didn't have a formal diagnosis until your mid 20s?
Yeah, so I was born in 1990 and I had surgery in 2018.
Wow, so it was 18. That's a, so
28.
yeah, doing the math real quick.
Yeah.
So
28
at
years.
28, so you went
Yeah,
16 years without really a formal diagnosis.
correct.
Was there a
Yeah.
point where a formal diagnosis and then knowing what's going on, it's probably two separate things, right? Like a formal diagnosis and then did you know through your own research that like what it was even before you had the formal diagnosis?
Yeah, I was highly suspicious because like if you're in debilitating pain on your period, like your quality of life is affected, you're missing school, you're missing work every month for several days, you're vomiting or fainting from pain. You're just like it's unbearable, right? And so that's not normal. And when that's happening cyclically, you know that something is off. And the symptoms, they extend far beyond that. It could be GI related, it could be changing your bowels, it could be looser stools, more constipation. You can have IBS-like symptoms. It could be body-wide extreme fatigue. It could be um, like mental health effects. Like it's a body-wide condition, right? So yeah, I suspected because it was quite
Mhm.
severe for a very long time.
This would make me think that a lot of times these things are misdiagnosed.
Oh yes. I don't know what the statistic is, so don't quote me on it, but I want to
Hmm.
say women are diagnosed with like 4 or 5 other conditions before they land on an endometriosis diagnosis.
Hmm.
IBS, various autoimmune conditions, fibromyalgia, celiac disease.
Oh,
So yes, very much so. Yeah.
all right. And that would make sense of the long term because if somebody goes to their doctor, they're probably, I would love to see how many specialists a female sees
Mm-hmm.
before they actually get the actual diagnosis of endometriosis, which, you know, can be quite frustrating for a female, I imagine, to be passed from doctor to doctor to doctor to doctor to doctor before even knowing what's going on. Once a woman gets diagnosed with endometriosis, is there a solid plan of attack? Once you get that diagnosis, is there sort of a protocol attack on it from there, from the medical side of it? Or are you back on the same track of, all right, well, let's try multiple different things to manage it? Or is
Mm-hmm.
there a direct way to attack it?
Yeah, that's a good question. We don't have very good management options right now. So, if you want to go the medical route, you're going to be presented with one of very few options. So, there are different types of pills. So you could do like a combination oral contraceptive, like a birth control pill essentially with synthetic estradiol and progestin. You
Hmm.
can do a progestin only pill, which just doesn't have a synthetic estradiol in it. You can do a hormonal suppressant, so gonadotropin releasing hormone analogs. So this is something like Lupron or Alyssa, which essentially put your hormones into postmenopausal ranges. So
Okay.
imagine like you're a fertile 20 something or 30 something year old female, and then it's basically tanking your hormones into a postmenopausal range. Um, and then so those are kind of on the conventional sort of Western medicine side.
Hmm.
Surgery is a management strategy as well. So that's not available to everybody globally. Also, not all surgeons are made the same, right? Some surgeons are trained to excise endometriosis lesions. And this is like a whole other topic, that I don't know if it would be super interesting for your, listeners or viewers to hear about it, but even just like the types of surgeries, right? There is a right type of surgery to
Yeah.
perform for endometriosis, which is the excision, not ablation, which is like superficially burning the lesions that can introduce a lot more scar tissue, a lot more problems down the road. And then you can start getting into sort of the non-conventional treatments, or I call them management strategies because I feel like maybe treatment would imply that it's maybe making something better when really a lot of these management strategies are more symptom management. So not really actually, with the exception of surgery, right? If you're actually removing the lesions, you are removing like physically the disease. But on the non-conventional side, we're looking at things like bioidentical hormones, like bioidentical progesterone, low dose naltrexone. And then of course you can, see somebody like me where we're working on diet, we're working on lifestyle targeted supplementation. So I don't know if I've answered your question there,
No,
but
it does. Yeah.
Totally.
Yeah.
I've heard, I mean, many times and through my own research that something like the Mediterranean diet is helpful for endometriosis. Is there truth behind that?
yeah, 100%. So the Mediterranean diet is the most well-studied science-backed diet for chronic inflammatory conditions for sure. We have the largest body of research on the Mediterranean diet. So definitely, and that's really kind of the diet structure that I aim for when I'm educating patients in practice. I kind of combine the Mediterranean diet, something called the Dietary Inflammatory Index, which is basically like a collection of studies where they measured which foods increase measurable inflammatory markers in the blood and which ones decrease inflammatory markers in the blood. And we really just try and load up the diet with a lot of those foods that decrease those inflammatory markers in the blood. And then I've added on a couple of like little things that are specific to endometriosis, like cruciferous vegetables and broccoli sprouts, and leaning into more like high moisture, low heat cooking methods, which we can get into if you like.
Oh,
But
yeah.
yeah, it's sort of a combination of those three things that I'll educate and guide patients on when it comes to diet.
Are a majority of the people coming to you post-diagnosis?
No, I
No.
have people who are not formally diagnosed. I have
Hmm.
patients who are, suspecting, some who have a surgery date scheduled but really want to prepare ahead of time for
Okay.
the surgery and to like maintain the benefits of the surgery.
Hmm.
And then I have some who come post-operatively after receiving a formal diagnosis. So it's a mixed bag.
Yeah,
Yeah, it's a
yeah.
mixed bag.
And I think the reason I asked that is like you mentioned the Western medicine side of this, and my guess is there are a lot of people that get diagnosed, and then a medical doctor tells them their steps,
Hmm.
and I think we're in a time where people are being very respectful and saying, "Hey, I think I want to look at some other options and find out what's best for me outside of this direct just pills and surgery, pills and surgery, pills and surgery, pills and surgery." And I
Mhm.
feel like we're at a time where people are starting to kind of find their voice
Hmm.
in with things like this to say, "Hey, before I go this route, let me do my research and let me explore some things prior to that." And that's where they come to somebody like you who say, "What other options do I have to manage this outside of maybe what the doctor is telling me or a combination of the two?" Right?
Yeah, I don't know if I fully understood what you said there, but you'd be surprised. Like, and this is one thing that I find extremely unethical and that's very frustrating about the endometriosis space. You'll have a lot of doctors and surgeons giving patients ultimatums. So they'll say, like, you must take this pill or I won't
Yes.
perform surgery on you.
Wow.
Or,
Oh.
yeah, and you actually hear a lot of that.
Mm.
A lot of like guilting of patients making snide comments like, if you don't take this, you'll be back to see me for a second surgery in a year. And that it's not even like rare, like that happens all the time in this space.
Mm.
So I'm not sure if I understood everything you
Yeah,
said there,
I
but
guess people are going to go, they get diagnosed. They see the
yeah.
doctor prescribe one way to go. And then people are saying, "Hey, I'm not sure if that's the best route for me. Let me look at other options." And then they search out somebody like you. I feel like what I'm trying to say is that people are looking for other options outside of just the medical route that the doctor can push them to.
Yeah, 100%. And I think a lot of my patients too are people who have tried the medical route and had terrible side effects because unfortunately a lot of the medications that are prescribed for endometriosis come with tons and tons of side effects. And whether you're feeling the side effects or not, like you're feeling low energy or you're, gaining unwanted weight or you're feeling very fatigued, like whatever the side effect might be, whether or not you're feeling that, there are things happening beneath the surface metabolically that these pills are doing, right? We know that oral contraceptive pills, progestin-only medications. We know they affect the thyroid. We know that they can cause some mild insulin resistance. We know they put a burden on the liver. And when you really pull that all together and you think about the implications of taking these meds, and when you really understand like the how endometriosis behaves in the body, I think a really important question to ask there is like, is this doing more harm than good? I don't know if that made sense,
Yeah, it does.
but like,
Yeah.
Yeah.
if we know that endo is estrogen dependent and something that we really want to focus on is estrogen elimination, and you're taking this pill that's putting a burden on your major detox organ, where two out of your three steps in estrogen elimination happen, we probably are going to want to think about that, right? Or at the very least, we're going to want to integrate some kind of support for the liver while taking that medication. So, I think I might have just completely veered
No,
off
That's okay.
no,
Take it
yeah,
interesting,
there.
no, no, yeah, yeah,
but
yeah.
yeah.
No, I like that. I mean, basically, there's a cost to everything you put in your body,
Mhm.
Yeah,
right?
yeah. And I'm not anti-pill or any kind of hormone therapy. I mean, I've been on them for my own endometriosis, and I know that some women just have a very, very severe form or a severe stage where they just need to be managing with some kind of hormone therapy. So I'm not anti these pills or anything. It's just that I want every single person who considers these options to be well informed about how they may be affecting their physiology, right? And then take steps to then mitigate those effects. So that's all I'm saying there.
No,
How effective do you think oral contraception actually is for majority of endometriosis patients?
That's a good question. I mean, we do have studies that post excision. So when the lesions have been like essentially cut out from the root, we do have studies that show various hormone therapies do increase the time to recurrence. So like with an IUD or with an oral contraceptive or with a progestin only medication, I think don't quote me on the statistic, but it's something like without hormone therapies, time to recurrence can be like 2 to 4 years. And then with a hormone therapy, it can extend it to 8 years. So we do see some advantages of taking them. But again, there's so much nuance here because if you're somebody who like has a really pro-inflammatory diet, maybe you're genetically predisposed to insulin resistance or fatty liver or something like that, and you tackle one of the like you tack one of these medications on with all of those risk factors, then I think that the time to recurrence could be a lot sooner, whether or not you're taking that hormone therapy, because like, do you get what I'm saying? Like it's
Yeah.
you're essentially putting more of a burden on this system that's very important for slowing endo progression. So it's very nuanced, right? And like, yeah, I mean, I could give you 100 examples like that, but I
That's what
think
we
there's some,
always
yeah, I think
we
there's some
always
value.
right. We always say like with any medication, it's not the magic pill, right? If you're going to be better, feel better, it has to be partnered with your sleep. How do you manage your stress? How do you manage your lifestyle, your diet, your exercise? And I think that's what a lot of people, I guess, Josh, to your point earlier, are starting to see. It's like, okay, I can't just take this medication and expect it to heal me entirely. I actually have to put in the work elsewhere for me to be, a generally healthy person or feel better regularly.
Yeah, for sure. I agree. I call them the unsexy basics, like
Yeah.
sleep, stress management, blood sugar
Yeah.
balance.
okay.
That's
Yeah.
always the foundation, 100%.
Mhm.
100%. Yeah.
What, how does endometriosis directly affect fertility? And how are you using nutrition? I guess, how are you using food as medicine? How are you using nutrition to make a direct impact?
Yeah, great question. Um, Maybe I'll just quickly mention because at the beginning, I think before we were recording, Josh, you said that endometriosis is when the uterine lining grows outside the
Sure.
uterus. It's not exactly that, actually. So that's a definition that you'll often find online that's inaccurate. So
Well,
it's
that is
when
the
tissue,
misinformation, right? You said there's so much misinformation. And in my
yeah,
little bit of research, I'm already exposed to
yeah.
misinformation. Yes.
Yeah, and this is a relevant difference because so the endometrial-like tissue, that's what I call it, or endometriosis lesions, however you want to call it, they are different in many ways to the endometrium. Okay, so some examples are there's much more aromatase activity. Aromatase is an enzyme that converts testosterone to estrogen, right? Because remember, endo is estrogen dependent. And so part of the way that it can self-sustain and grow throughout the body is it can produce this estrogen that helps it then grow and spread throughout the body. So that's one huge difference. Another is there's significantly more pro-inflammatory chemicals produced at the level of the lesions, interleukin 6, tumor necrosis factor alpha. And this also contributes to their growth and spread throughout the body. That doesn't happen so much in the endometrium. And then also we see more growth factors. So things like VEGF that also contribute to the growth of these blood vessels, right? The lesions developing a blood supply so that they can grow and spread throughout the body. So these are some huge differences, right, between the endometrium. But they're endometrial-like, so they do share some similarities to the endometrium. So just in case your viewers are like, okay, they're talking about endometriosis. What is that? So it's a chronic inflammatory condition where tissue that's similar but not identical to the endometrium grows outside the uterus. It's been found on every organ of the body. It can, we'll get into the topic of infertility in a second, but it can cause, debilitating pain, fatigue, muscle cramping, IBS-like symptoms, constipation, diarrhea, abnormal bleeding, pain with intercourse, pain with passing stools, pain with urination, and the list goes on. Okay, so now on to your question. Sorry, I hope you don't mind that little. I just wanted to clarify the definition. Okay, so there are many ways that endometriosis affects fertility. So one way is there's this underlying immune dysfunction with endometriosis. So in people like myself with endo, the cells of our immune system don't work as efficiently as in somebody who doesn't have endometriosis. So when these endo lesions are attempting to develop a blood supply and grow throughout the body, my immune cells are supposed to rush to that site, clear out the endometriosis lesions, and then carry on and do the rest of the work of the immune system. But because there's this dysfunction within the immune system, it does clear some of it away, but it doesn't clear it fully away. So these lesions are then able to develop a blood supply, and grow throughout the body. So in terms of infertility with endometriosis, you can have an overactive immune response. And this is actually something that you can measure in very specific blood work. Like an example of this might be a lymphocyte map, or Fertility has a really great panel where they also tell you a little bit about your immune response. So like you can measure elevations in natural killer cells. You can measure deficiencies in T regulatory cells in your Th1 to Th2 branch of your immune system, which is essentially your pro-inflammatory branch of your immune system and your calming anti-inflammatory branch of your immune system. So you can measure these things. And when you have an overactive, immune response with endometriosis, it's a huge barrier to fertility because sperm is foreign to the female body. So if your immune system is very primed, very active, and that sperm enters the vaginal canal, the cervix, it starts to swim towards the egg. If your immune system is very, very overactive, it can actually attack that sperm, making it harder to get to where it needs to go. A second way on the immune dysfunction front is when the embryo attempts to establish within the endometrium. There's this little subtle shift that has to happen in the immune system on the part of the mother so that she doesn't reject the embryo, okay? It's a very fascinating, very beautiful thing that has to happen in the body. But when you have this overactive immune response, your immune system can be so active that it actually essentially rejects that implantation. And so you can have this recurring implantation failure that happens with endometriosis as well. So that's just one way endo can affect fertility. There's also, we know that there's an increased risk of other autoimmune conditions with endo that can affect fertility, things like Hashimoto's, like really elevated thyroid antibodies. Celiac disease, I've had patients who were able to actually become pregnant and sustain a pregnancy by identifying celiac, cutting out gluten, doing a little bit of work on the gut microbiome, and then naturally were able to conceive and sustain a pregnancy. Hormones would be another thing that we're thinking about. So whether it is really high estrogen or testosterone driving a lot of inflammation, estrogen, of course, also builds the uterine lining. So if you're making a lot of it, you're going to get a very thick uterine lining, which is not ideal for fertility. Progesterone is our progestation ovulation hormone. We see a lot of progesterone resistance in endometriosis, which makes it very difficult to sustain a pregnancy or achieve a pregnancy. Prolactin is a hormone that we see abnormally elevated in endometriosis as well. And prolactin will suppress your FSH and LH, which can block ovulation, which is obviously necessary for fertility. And it also acts as a pro-inflammatory chemical, right? Also driving inflammation. So, I mean, there's more I can say on the hormone front, but those are just some examples there. And then, of course, inflammation. So, inflammation is even separate from the immune dysfunction component. I mentioned previously that there's a lot of these pro-inflammatory chemicals that are made at the level of the lesions. And so if you have them there in your pelvis, surrounding your reproductive organs, that's going to there's potential there for it to cause a lot of damage to your egg quality. The inflammation in your body can damage sperm. It can make, inflammation very present around the uterus, which can make implantation or sustaining a pregnancy very difficult. So lots and lots of ways, right? Slowed blood flow to the pelvis. And then there's also structural issues. So you can have blocked fallopian tubes due to endometriosis lesions. You can have large, what we call chocolate cysts or endometriomas, which are an extension of the disease. So if you have a large chocolate cyst or endometrioma, this is automatically a more advanced stage of disease, so stage 3 or 4. And because they grow on the ovaries, it can really affect egg quality and egg reserve. So that's a very common problem that we see in the endometriosis space. So, those are just some reasons, right? I would say that those are the big ways that endometriosis affects fertility. And then, the second part of your question around nutrition, maybe you guys can stop me if I start going down a rabbit hole here, but
go do it. We love it.
So I would say like anything that kind of just piggybacks off of everything I just said, right? So on the immune side, so nutrition as a tool here, first of all, you want to make sure that you're avoiding synthetic ingredients, because when you're putting synthetic ingredients into your body, that creates more confusion in this already confused immune response, right? If it's an ingredient your body doesn't recognize, it's going to do what it knows how to do really well, which is to react, right? React to these ingredients that it doesn't recognize. So we really want to limit synthetic, processed ingredient consumption for that reason, to support the immune system. You also want to make sure you're getting all of the immune supporting vitamins and minerals, right? So your active vitamin A, your retinol, your vitamin D, your iodine, your selenium, your zinc, your omega-3s, to support that dysfunction within the immune system, right? If your immune system relies on these vitamins and minerals, these omega-3s, deficiency is only going to make that worse, right? So we want to make sure we're getting all of those in through diet or through a combination of diet and supplementation. If you're dealing with something like thyroid autoimmunity, for example, there is some research that high dose iodine can exacerbate this. So there are these like more specific scenarios in which we want to be a little bit more concerned with like specific minerals, like in the case of thyroid autoimmunity, not supplementing or eating too much iodine sources. The other thing I was going to say is with the large endometriomas, we know that zinc and vitamin D deficiency are associated with larger endometriomas. So making sure we're getting adequate zinc, vitamin D. And to go back to the conversation about the unsexy basics, those are so important for immunity, right? So those are just some things we're looking at on like the diet, holistic side. There's so much we can do for hormones. We know that B6 is a precursor to progesterone. Omega-3s, zinc, selenium, vitamin D, these are also really important for progesterone production. There's lots we can do in the way of diet for supporting estrogen elimination, adequate fiber. We know that fiber doesn't just help with bowel regularity, and the third step in estrogen elimination is through the stools. But it also can bind up estrogen, making it easier to carry out of the body. Lots of cruciferous vegetables, broccoli sprouts, and daikon, which is Japanese radish. Extremely concentrated dietary sources of something called sulforaphane, which is really protective for the liver. And that just kind of takes us back to the liver being so important for estrogen elimination. Adequate hydration so that we're actually absorbing our B vitamins and our vitamin C, which are very important for inflammation and estrogen elimination at the level of the liver. Like there's so much that I can say. I don't know if you want me to keep going, but
No. I think that's all. there's a commonality to a lot of conversations we've had just around basic health, and you said it multiple times, is inflammation.
I was just about to
Hmm.
say
It
that.
seems like inflammation is coming
Such a
up
word.
I don't care what we're talking about. I don't care what the subject is. I don't care what the topic is of that day, or even me and Gray dealing with some of our own clients. It seems like everything is funneling back down to inflammation
Mhm.
and
Hmm.
managing inflammation. And another thing that you're talking about that is common conversations I've had recently is the ability to clear estrogen.
Hmm.
I feel like those two, when you said those, they perked my interest because I'm like, oh, this is a recurring theme. And
Hmm.
how can we consistently manage inflammation within the body? And you used a term that I think could click with people. And sometimes you say the same thing to people over and over until you say something that clicks. You
Hmm.
didn't use the term processed foods. You used the term synthetic foods.
Mhm.
And when you said that, the first thing that clicked in my brain was, well, why would anybody want synthetic foods in their body? Right? That's the first thing. But when you hear, I feel like we've heard the word processed foods so many times, like we're just
Hmm.
like overwhelmed with, yes, processed foods, processed foods, processed foods. It becomes kind of like white noise.
Hmm.
And then when you said synthetic foods, I went, oh, well, who the hell wants that in their body?
Hmm.
Right? And then I thought, well, of course my body's going to treat that as a foreign object. It is a foreign object.
Hmm.
And how my immune system treats that can throw every process in my body out of whack.
Totally.
And when you're dealing with somebody ground based, somebody comes and sits down with you, you get all their information. Is managing inflammation that small hinge that swings the biggest door for you when you're working with people, or are there other things you deal with first?
Mm. Great question. I
Okay.
mean, yes and no. So, I mean, inflammation, endo is a chronic inflammatory condition. So, whether or not you're experiencing pain symptoms, there's inflammation at the heart of that for sure. But what managing inflammation looks like might be a little bit surprising because inflammation is coming from everywhere with endometriosis, right? So typically the first place I start, which does overlap with inflammation, is the gut. I always start with the gut because it's a major site of inflammation. It's where 70% of our immune cells are located. It's sort of like, you know, it's a faster way of getting to your destination. Like if you went the route of, okay, let's just tackle an anti-inflammatory diet and let's get you on anti-inflammatory supplements, but somebody's having like very significant GI issues that require like significant or not significant, but specific intervention, you're going to be spinning your wheels. Like, yes, you might feel a little bit better because you've transformed your diet, you're eating more anti-inflammatory, but you probably need to be implementing some specific uh, GI goals, right? Like something to kind of get you eliminating better or bulking up looser stools. So, yeah, I start with the gut, but because the gut is a major site of inflammation, that automatically positively spills over into less inflammation as well.
That sounds like you're killing two birds with one stone by attacking the gut first.
Yeah, so gut first, you're already seeing inflammation reduction, and then typically I move into hormone support. So we look at the hormones, we look at what needs to be optimized there, and by tackling that, you're also reducing inflammation. Because if you remember back to me saying, high testosterone, high estrogen, high prolactin, low progesterone, they all contribute to inflammation. So every step of the way, you are tackling a little bit of that inflammation or a lot of that inflammation, depending on, your unique case. And then we move into more like, okay, those two huge areas of inflammation we've tackled. We're seeing really, really good improvements in pain symptoms and energy, all these wonderful things in digestion. Then I go a little bit deeper, right? Like where else could inflammation be coming from in your body? Do you have high insulin? Do you have elevated liver enzymes? Do you have high eosinophil markers? Do you have nutrient deficiencies that might be contributing to your inflammatory load? But that's like typically the sequence that I move in for most people.
When you
With
say,
your, go ahead. No, you
no, no,
got
no,
it. Go
go, go.
ahead.
When you say significant GI problems, in my experience dealing with people, people have had GI problems for so long that they say,
Hmm.
well, that's just who I am. I've always been that way,
It's
right?
Hmm.
normal.
It's
Yeah.
normal. Oh, well,
Mhm.
that's just me. I don't use the restroom every day. I do every 3 days. That's just how I am, right?
Hmm.
I hear that a lot from people. I'm like, well, no, that's not normal.
Yeah.
So people tend to not think they don't have a GI problem because they've always been that way.
Mhm.
Hmm.
When you say major GI problems, can you give examples so someone listening to this might say, well, I don't have major GI problems, but then they really do. They've just seen it as I've always been that way. What would be some of
Mhm.
those issues?
Hmm. Constipation, diarrhea. If you're not producing bowel movements every day and you have endometriosis, that's not good. I don't care if it's your norm. We need to get you having them every day. Um, Softer stools or diarrhea, like stools essentially that are not formed, because that's telling me, food's moving through you a little bit too quickly. You're probably not able to extract all of the nutrition from your food, and that's really problematic for endo because we want to be using that nutrition to help fight inflammation. Sticky or hard to wipe clean stools is a big one. So I always tell people that your gut is a mucus membrane. So when it's irritated, it secretes a mucus that mixes with the stools and it comes out this hard to wipe sticky stool. So if you're experiencing that often, that's a really, really big, clear nugget of information that there's inflammation there. Undigested food in the stool, floating stools, greasy looking stools, abnormal burping or belching, a bad taste in the mouth, bleeding gums, if you're bloating every single day, yeah, urgency with passing stools. I mean, blood in the stool, but I don't see that one very often. That's something I'll immediately refer somebody to see a doctor for because that's more serious. But I would say that those are the big ones. Feeling full with a few small bites, right? So if you're like starting a meal, you have 2 bites and you're just feeling abnormally full, that's not usually a very good sign. Heartburn, reflux, those are all symptoms that I pay attention to.
Hmm.
Does endo present any skin issues? Have you ever seen that with
Yeah, that's
patients?
a really good question. I have a YouTube channel and I just wrote a script on the overlap between endo and these like skin conditions. A lot of these skin conditions, right, like psoriasis or acne, like cystic acne, hives, rashes, they all have inflammation at the heart, right? So there is the overlap there in that when there's inflammation, it can often present on the skin. So 100%. And then depending on what it is, my approach might be a little bit different. Like if it's cyclical hives, that corresponds with the high estrogen phases of your cycle. I'm probably thinking that that's more histamine driven, right? We probably need to work on figuring out what the heart of that is, right? Is it high estrogen? Is it poor elimination? Are you constipated? Is it GI related imbalances? But yeah, yeah, very common, and they share that inflammation piece at the heart.
Has there been any management strategy that surprised you, like positively surprised you that you've implemented with your patients?
Mm,
Might be a funkier question, but anything that maybe was even newer that you tried?
just from like the holistic side.
Sure.
Um, I don't know that there's been anything newer recently. There's a lot of small intestinal bacterial overgrowth in the endo space because endo presents with a lot of risk factors for SIBO. So I find those treatments, I mean, it's been a while. I don't know that that's necessarily surprising me right now, but I'm trying to
You-
think if there's anything. I really like there's a new concentrated like turmeric supplement that I'll sometimes use, and I really like that in people who have like in women who do have a fertility focus and we do the like the more advanced lymphocyte map testing. If it shows that they do have like a very abnormal aggressive immune response, we do know that like turmeric curcumin in like cell line studies actually did help like suppress the lesions. So even though, we're lacking still in terms of the human studies, I do find that there can be some application for that. So I do like that. I don't know. That's a good question. I'll have to think about it. I don't know if I have an answer for you just off the top of my head.
That's okay. I feel like You probably see a lot of cyclical things now, like you have a very
Yeah.
direct route with helping patients, but I think it's always interesting if there's like, oh, I tried this with, a patient where I didn't know if this would work and it did, you know.
Yeah, I don't know. There probably is like a few examples of that. Castor oil packs are an interesting one, or red light therapy.
Okay.
Like it's very hit or miss, though. I don't see like a consistent improvement with those strategies, but when they do work, they do tend to work really, really well. Um,
Do you think that's more placebo? People feel like they're feeling better, or do you think it's actually like it shows big markers of people feeling better?
yeah, I mean, it could be, but we do have studies on red light for
Do we really?
sure.
Yeah,
That's interesting
definitely.
to me. What have you seen there with the red light therapy?
Yeah, that it can help anti-inflammatory. It helps wound healing, so it might be there's helpful application for post-operative healing. There's even some studies that showed, and I don't personally know of a brand that sells like
Yeah.
intravaginal red light. But
Uh,
they actually did a study where red light, like vaginally, helped improve the vaginal microbiome because we see a lot of overlap
Wow.
between imbalances in the vaginal microbiome and fertility outcomes. So they did a study like that, and it showed it actually helped with the environment, so making it less inflammatory and with achieving pregnancy. So yeah, lots blood flow, anti-inflammatory benefits.
Well, so I knew the red light therapy was beneficial because I've dealt with acne, and so they always put you, under the red light therapy
Mhm.
with your skin. Is it like a doctor's office that you would go to get that done vaginally, or it was just a one-off study that they did? Because I immediately thought of vaginally sunning, which I know you're not supposed to do. Have you heard of that before? Where you
Is that like
lay it?
yoni steaming?
Yeah, I think so. Where you like lay in the sun, naked.
Oh, interesting. And what is that supposed to do?
I think kind of the same thing. I'm not positive, but that's immediately where my mind went. But where would you do vaginally
Yeah,
red light therapy?
that's a good question. I do think you can buy. I do think they exist that you can buy
Okay.
these red light therapy things that you can insert vaginally. I've had a couple of clients actually tell me that they do it. I don't think, I'm not aware. I mean, I'm not saying it's not available, but I'm not aware of any place that performs that
Right.
service.
Same.
And I guess like you could technically purchase your own wrap or red light lamp and you could kind
Yeah.
of sit in front of it and it would be more of like an external application than internal. But I think there are better ways to support the vaginal microbiome
Yeah.
anyway. But definitely like wraps for like around the pelvis. You can place it over the liver. You can do red light over the thyroid. There's really good studies on 10 minutes of red light therapy 3 times a week for normalizing T4 and T3 ratio
Wow.
and reducing thyroid antibodies. So yeah, there's lots of applications for red light that are, directly relevant for endo. Yeah. Yeah, it's
That's
really
so
fascinating.
interesting. It is
Yeah.
really fascinating because you would never think that like simply just a light would produce any
Yeah.
results.
I
Hmm.
know. I don't like personally, I don't know that I've like experimented with it enough. Maybe I should actually do like 30 days of red light therapy use and see if it actually makes a difference. But my husband hurt his knee in his ski accident and he was putting it on every day and he was noticing a huge difference. So I'm like, okay, all right,
Wow.
maybe like maybe I
Maybe
should
it's
actually do it.
yeah.
It is my
No.
wrap after all. I spent all this money on it. I'm not even using it, but yeah, maybe I'll experiment with that in future. I don't know.
That's very cool.
that
Yeah.
is that is interesting. I've years and years and years ago, uh, when kind of like the biohacking thing got pop. I
Hmm.
don't know if I just noticed it, so it got popular, or if there was like 7, 8 years ago, I feel like everybody was biohacking. Here's a biohack. Here's a biohack. I did have a guy try to sell me red lights in the nose.
Oh.
There were where he'd take red lights and you hold it and stick it up your nose for a certain amount of time
Mhm.
a day. And I just remember at that time I'm like, man, I'm just trying to eat right, exercise, sleep right.
Yeah.
Like I got some prime movers I'm trying to worry about before I'm you know laying with
Sticking up my
sticking
nose.
sticking red lights in my nose. I just feel I got some other prime movers I think
Yeah.
that I'm trying to, because this is an industry, and if you are somebody, either you're a woman watching this and you have endometriosis or you have concerns about it, sometimes this can be like getting a drink of a water through a fire hose, right? They
Yeah.
could watch this and be like, holy cow, I need to, it's kind of like talking to people about environmental factors around their health. Um, Someone could be like, I got 25 Glade plugins in my house. Am I going to get
Mm,
to the point where I'm getting rid of all my 25 Glade plugins, or like I ended up down the rabbit hole. We had somebody talk to us about an app that you could scan your skin products and your hair care
mhm.
products
Yeah.
and those type of products, and it could tell you like the environmental issues or the toxicity of that
Yeah.
in your skin. Do you deal with any of that? Because that has been a thing for me lately in our home.
Hmm.
I have a wife that's a very much into the candles, and she's a makeup artist, right? So when I say things like, maybe that makeup, like I get stabbed in the neck, right? Because
Yeah.
changing her makeup is that's personal, right? And
Yeah.
so there has been some talks around our house, like changing from plastic Tupperware to now, like when I make my big rice, it goes into the glass, right?
Mm.
Um, do you deal with any of that from the environmental side? Do you talk to people about the environmental factors and how they address their hormones? This is very new to me because
Mhm.
I am, and Gray will tell you, there's skepticism and then there's cynicism in this industry. Then there's me. Like I'm like I'm not skeptic. I'm not cynical. I think I have my own like level of prove me first level. And
Yeah.
I think that's probably the wounds from the industry for so long, right? The so many things that came out that you just weren't true, right? Or like you said, misinformation on the internet. This subject is new. I would like to hear your side of talks about if you have talked with people about the environmental factors and how it relates to endometriosis.
Yeah. So there is established research on endocrine disrupting chemicals being a risk factor for endometriosis development. So specifically dioxins, phthalates, which we find in a lot of our beauty products, shampoos, and things like this. And certain heavy metals, the research isn't as strong, but things like chromium, for example, copper, which is just a mineral, not so much a heavy metal. So definitely these things matter, 100%. It's established science that they can interact with various hormone receptors, they can displace hormone receptors, they can activate hormone receptors. So yes, it's definitely a conversation I have with people. The thing with this topic is it's quite a transition, right? Like if you're somebody like who you described, like you've got Glade plugins, you're heating things up in plastic, like you're using a lot of like chemical laden products, cleaning products or beauty products. These things cost money, right? So it's a bit of a transition. You need to spend a bit of time like slowly making these shifts. But it is absolutely 100%, I would go so far as to say necessary with endometriosis, because they can interact with these receptors, right? And we want to make sure we have the most control over what our hormones are doing. So I'm not going to take credit for this. This is another dietitian kind of colleague online that I met who came up with this idea, but I really like it. So I'll share it, which is, start with the things that go into your body. So, like, for example, if you're not filtering your water, get yourself a good quality carbon filter or reverse osmosis system, like something that actually filters out hormones, chemicals, uh, like a lot of these environmental chemicals, the phthalates, the dioxins. So get yourself a good quality water filter. So in your body, then what you put on your body. So your creams, your shampoos, even like the clothing that you wear, if you're wearing a lot of like synthetic materials, start making shifts there one by one, just slowly, working on replacing your products with cleaner products that don't have as many of these EDCs, these environmental chemicals, and then around your body. So then you might be thinking about um, yeah, like candles or like these types of things in your environment and just slowly start making shifts in those areas. But yeah, it's not like voodoo science. It's absolutely established science. It's important. We live, unfortunately, in such a polluted world right now, right? It's like it's wild. I used to be a little bit more into this. Like I used to encourage patients to download like the air quality app to gauge like what's going on in your air outside your home. But there's only so much, that we can take on ourselves when it comes to this topic. But yeah, it's definitely, I would say, required for sure to pay attention to with endo.
I like that concept of in your body, on your body, around your body. Yeah,
Mhm.
Yeah.
that's pretty smart. I do feel, I've had people, uh, I have friends that were starting to make changes, and we always help our friends, right? And I, I have when I have friends reach out to me, I always have conversations with friends because I care about them. I want them to be healthy. I know them, they know their children, and it's just interesting to watch people cherry pick the side of you know, they'll cherry pick the information and apply it when that's just such a small amount of the change it can make, right? You know, especially when a lot of media came out around preservatives in the food. There's so much that was coming out, and I would have friends like message me and be like, "How am I supposed to get healthy when they're poisoning our food?"
Yeah.
And I'm like, "Well, bro, you have a choice, right? You have a choice. I understand the concept of what you're saying. Yes, we're like you said, polluted world. I'm gonna use that when you said polluted world as another one that kind of was like, oh, yes,
Mhm.
that rings true to me. But so many people were using that as their scapegoat to say, well, this is why I can't get healthy.
Mm. Yeah.
We live in a polluted world, so I can't do I it's impossible, so I even try. And I'm like, no, you can start minimalizing the big things. Like that's not your excuse, right? I told Gray I went on a 12-week kind of food quality nutrition plan where I ate out or ate processed foods like 3 meals in 12 weeks. And it was very intentional. It was very challenging to do
Mhm.
it.
Yeah.
And I went back, started adding some regular foods. And the first thing I noticed was that acid reflux
Mhm.
immediately came back, like
Mhm.
heartburn. Um, Digestion completely changed in those 12 weeks. It got completely different.
Mhm.
Um, and then like morning fatigue, morning brain fog, like my brain in the morning. Like as soon as I start adding some of those foods back in, just eating like a normal diet, cognitive function and digestion were the first two that were like, oh, that's different. I didn't have that before. Right.
Mhm.
And I don't know if it's inside and I sent a message. We have a friend that works in functional medicine. I messaged him. I don't even know if this is, again, science. I don't even know if this is real. My sweat changed.
Mhm.
Gray, I almost messaged you, but I sent it to Mike. I almost sent it to you. My sweat and the feel of my sweat on my skin and the odor of my sweat,
Yeah,
like all
yeah.
of a sudden, so embarrassing, right? All of a sudden, I smelled bad. Like when I would sweat, I'd be like I'd grab a shirt and I'd be like, is that me? Or can I blame this on somebody else? Is this my 9-year-old son's shoes that can walk on their own, or is that me that smells so bad? And that was just so alarming to me of like, wow, I'm putting in synthetic things in my body. I'm feeling that. Who knows what it's doing on a hormonal side
Mhm.
or a woman's reproduction side? That is a topic that, like I said, I used to be skeptic about. That now I'm just like, no, it's a legitimate thing. What has been one of the things that you get the most pushback from women when we talk to them about change? What has been the one that they've been most reluctant? Because if I'm sitting here and you're telling me to do some things, and I've never really done much for my nutrition, but I've tried everything to do with fertility to improve it. Do you have certain things that some women, like I said, if you told my wife that she would have a 170 IQ if she quit using her makeup brand, I'm telling you it wouldn't happen. And I would say that right in front of her, and she'd look at me and be like, yes, I would not change it.
Yeah.
Not a chance, right? What do you
Yeah.
get the most pushback? And we'll kind of end on this. What's the most what do you get the most rub back from women on things when you tell them they need to change some certain things?
Yeah. So, well, the one thing I would say that it's not so much pushback because I always try and make a point of giving a really good explanation as to why we're doing this, right? Because I think if you can understand why I'm asking you to do something, you're going to be a little bit more inclined to do it. So, but I would say one thing that a lot of clients struggle with is just meal structure and spacing. I think we live these busy lives where, sometimes we can't manipulate the time of our meals because we have meetings or we're in back-to-back meetings for 6 hours or we're on our feet working and we, can't step away to have a meal. But blood sugar stability is a huge, huge, huge foundational piece to keeping endometriosis symptoms well managed, like assuming that management style works for you because it doesn't work for everybody. But structuring the meals to include the protein, fat, fiber, spaced 3.5 to 4 hours apart, like that is huge for me in my practice. So it's not so much pushback, but I think collectively a lot of women really struggle with consistency there. But in terms of pushback, and I try not to, I'm very, very big on a non-restrictive approach. So I know other, professionals in my space with endo, they go down this long list of foods that women have to exclude for managing their endometriosis, holistically or naturally. That is not my approach. I will only use dietary restriction if I feel like it's absolutely required, like in the cases of a treatment diet or if somebody has thyroid autoimmunity and we know that removing gluten can be really helpful for reducing thyroid antibodies. That's probably the thing that I'll get pushback on, to use that term, is just that dietary restriction. Probably most often it's gluten, which kind of goes back to the point of like the synthetic ingredients and what it's doing to your body. Because, I always tell people like, listen, it probably wouldn't be so hard for you if you were only eating the whole food sources of gluten, right? Like if you were doing like spelt based like something spelt, right? Or barley. Like if you were having barley for breakfast every morning, it probably wouldn't be so difficult for you to pull that out. But it's because it's like your breads and it's like the convenient takeout stuff that you can get at the store when you're, rushing in the morning or looking for something to eat at night, or when you're at the airport and the only options are, gluten containing sandwiches or something like that. It's always the processed stuff. And so then my next question is it the gluten itself that's the problem, or is it the fact that it's coming from processed sources? So anyway, I went down on a bit of a rabbit hole there, but probably that would be the thing that I get the most pushback on. Yeah. But
Hey, what
I
about
try not to, uh, insist on exclusion unless I think it's absolutely required.
yeah, that can be so overwhelming for people, right?
Yeah.
What about dairy? Where does dairy play in this? Does dairy play a role for you here?
Yeah, so it's a great question. It's not a simple answer. So a
Okay.
lot of people, and this is one of those things where I would consider it maybe not misinformation, but it lacks the context, right? For people to make like an informed decision about whether they want to remove it. So if you're going to respond to dairy negatively as somebody with endo, because first of all, if you look at the studies around dairy and inflammation, almost all of the studies tell you quite the opposite, right? They tell you it's anti-inflammatory because dairy products are one of the most um, concentrated vitamin D sources, right? Because a lot of them are fortified or have naturally occurring vitamin D. And then the fermented sources are one of the best dietary sources of probiotics, right? Which are very, very important for your immune system. So when you actually look at the studies, it tells you quite the opposite, that it's anti-inflammatory, very protective for fertility, especially for women who have anovulatory cycles or who are very underweight. So this claim, I don't even know where it came from that it's inflammatory. I don't know. Maybe I'm missing something. Maybe I'm living under a rock. I don't know. But you can react to specific things in dairy, right? So I'm not saying it's not inflammatory. It's just, it has to be approached on a person to person basis, right? Or like a case by case basis. You can respond to the A1 beta casein protein, right? You'll probably know if you're having a reaction to that because you're going to get really aggressive diarrhea. You're probably going to get a lot of abdominal cramping, urgency, pain, maybe bloody stools. It gets a pretty severe reaction that you can have in that case. You can also react to the lactose sugar, right? So if you're lactose intolerant, or if you have a threshold for lactose, you might again get a bit of those IBS-like symptoms, constipation, diarrhea, abdominal urgency, cramping, pain. So again, that's another thing that you can be reacting to. Then we move into sort of like the histamine piece. Are you somebody who's histamine sensitive? Do the fermented sources cause symptoms? Do they create some itchy skin, itchy eyes, runny nose, congestion, low-grade fever, body aches? So that's another thing that we have to look at. Like, does that apply to you? Are you somebody who's histamine sensitive? Then another thing we can look at is hormone sensitive individuals. So the research on whether the hormones in animal foods being bioactive in the human body, they're not that great. I think there's like maybe one hormone, I think it's estrogen, where they showed high intakes in men in particular, I think were associated with more prostate cancer or something like that. But we don't fully understand like how bioactive these hormones are in the body. But I do think, and I would say confidently, that if you're hormone sensitive, like if you're somebody who has raging estrogen dominance symptoms, you probably want to approach dairy cautiously because there can be some bioactivity from those sources. So these are kind of the four things I would look at, right? Could you have an A1 beta casein allergy, in which case maybe opt for the A2 beta casein sources or sources that are significantly higher in the A2 beta casein. So, your sheep, your goat sources, things like that. If it's a lactose intolerance, maybe you opt for the lactose-free versions or tack on a lactase enzyme. If it's the histamine piece, I get a lot of comments on my content when I post about histamine. But what I want people to know is histamine is like its own problem. You need to figure out what the source of that is. The solution to that problem is not to eat a low histamine diet indefinitely. That's going to be very destructive for your gut microbiome. Your diet's going to be very limited. You're going to be miserable. So you need to figure out, like, is it gut related? Is it SIBO? Is it high estrogen? Is it a stealth infection? Is it mold exposure? Like stress? What is at the heart of that histamine issue? And then when it comes to the hormone sensitivity, I would probably remove it in that scenario, or maybe play around with sources, maybe see how you do with goat or sheep sources. I have a lot of clients who do really well with sheep sources and then they stay away from the cow dairy. But it's a very nuanced topic. So it's not like black and white,
Yeah.
100% no for everybody or 100% yes for everybody. Yeah, that's how I would
No,
respond
I
to
love
that.
it. I love the fact that you added context to it because people do tend to paint a broad brush with dairy,
Yeah.
and people paint a broad brush with, gluten wheat is you, you'd be surprised how many people come to me that have never had the testing. They say, "Well, I just think I'm allergic to gluten."
Yeah.
Hmm.
I'm like, "So you
I
have
probably
celiac?"
wouldn't be that surprised because I probably
Yeah.
share in that
Yeah.
experience.
Yeah.
Right.
Well,
Right.
I just pretty sure I have I'm allergic to gluten. So did you get diagnosed for celiac disease? And they go, "Oh no, it's just every time I eat, it bothers my stomach."
Hmm.
Well, I don't know. I said, I don't know. Yeah. I like the context. I like the context side of the dairy because you're right. People do paint a big broad brush. There's so many people that come to me and say, or they start working with us, and I say, "What changes have you made?" It's like, "Well, I cut out dairy." I'm
Mhm.
like, "Oh, okay, cool,
Oh.
right? Yeah, cool." If somebody needs to find, can you let us know where somebody can find? Now, when we post this stuff, we're always going to link to you, obviously, so people can find you. But can you tell people where they could find you? Because my hope is that there is somebody out there that watches this and it's like, wow, maybe I've been dealing with this for 13 years and never addressed
Mm.
it, and we can refer them to you or they can find you. How could somebody find you?
Yeah, so my most active platforms are Instagram. So my handle there is endo.fertility.dietitian with two T's, no C. And then probably YouTube. So I post twice a week there, and my channel is the Endo Fertility Space channel. And I'm on TikTok as well. I'm not as active there. I post like once a day, but you can find me. Same handle as Instagram, so endo.fertility.dietitian, and then my website's endometriosisdietitian.ca. And I'm quite responsive, so if you do shoot me a
No,
DM,
yeah,
I
yeah,
back to
absolutely.
you.
Absolutely. We
Perfect.
thank you for coming on. This has been this series. You're kind of launching our series, so to speak. Um, when Greg came to me and said, I want to do this series around this, my first thought process is like, well, I'm going to bring a notepad and a pen because
For
I'm definitely one that knows very little, so it's very educational. And this was very educational. And what it did prove to me is getting online and typing what is endometriosis and what is the cause. I
Mhm.
learned that the first three things that pop up aren't always going to be true,
Mm.
right? So that's the, and which can be so, if that's frustrating for me, how can that be frustrating for the person that is really struggling with it,
Mhm.
right? Or how can it be for you with, you probably spend so much of your first meetings dispelling myths around it. We've heard one of our friends calls it relearning.
Mhm. I
So
love
much
that.
educational relearning, right? So I thank you very much for coming on, and taking your time and coordinating this. And you're very busy, so we really appreciate you coming on.
Yes,
Yeah,
thank
my
you so much,
pleasure.
Cindy.
Yeah, my
Thank
pleasure.
you.
Thanks, guys.
Yep, thank you.
Good luck with the series.
Thank you very much.